Your knee pain has a zip code, and most people are treating the wrong address. Say a patient comes in and says, "My knee hurt." I ask where exactly, and they point to a general area like they are showing me where Canada is on a map. Some people circle their entire leg like they are indicating a weather system on the news. But front knee pain, inside knee pain, outside knee pain, and back knee pain are four completely different problems. And if you're just icing the front when the problem is in the back, you're wasting your time. I'm Dr. Kellum, orthopedic surgeon, and I have 20 years of learning to read this code. Today, I'm showing you exactly how to decode where your pain is coming from. Zone 4 is the one that sends people to the ER thinking something serious is happening. Let me show you why location is everything when it comes to knee pain. Most doctors treat all knee pain the same way, but your knee has 4 distinct zones, and each zone is telling you completely different stories. Front knee pain means your kneecap is tracking wrong. Inside knee pain usually means meniscus or ligament tissues. Outside knee pain, well, that's friction. It's usually from your IT band. Back knee pain is fluid buildup or tendon strain. And here's the part that matters most. If you treat the front knee pain like the inside knee pain, you will spend 6 months doing the wrong exercises and wondering why nothing is changing. I see this constantly. Someone is doing quad stretches for a meniscus tear because they are treating the wrong zip code. Let us decode all 4 zones. Zone 1 is front knee pain, around your kneecap or behind it. You feel it climbing upstairs, squatting down, or kneeling. Sometimes after sitting with your knee bent for too long. Like after binge watching an entire season of something you swore you would only watch 1 episode of. This is the most common complaint I see in people over 40. And here's what is actually happening inside. Your kneecap sits in a groove at the end of your thigh bone. When you bend your knee, that kneecap slides up and down in that groove. But when the kneecap starts tracking crooked, it grinds instead of glides. Think of it like a drawer that does not close straight anymore. You push the drawer in and it catches on one of the sides. You have to wiggle it, adjust the angle, and force it to close. That is your kneecap when it's tracking wrong. It is grinding on one side instead of sliding smoothly. So why does this happen? Usually it's weak quads, sometimes it's tight hip flexors, and often it's weak glutes letting your leg collapse inward. What fixes it? Strengthen your quads, especially the VMO, which is the teardrop muscle right above your kneecap. Do terminal knee extensions, straight leg raises, and step ups with controlled movements. Stretch your hips flexors so your knee can extend without pulling. But for most knee pain, front knee pain that is, it's just muscle imbalance you can't fix without constant work. Red flag to watch for? If you have sudden swelling after trauma, plus an inability to fully extend your knee, that needs urgent evaluation. But most front knee pain is just muscle imbalance you can fix with consistent work. Now, zone 2 is where things start twisting. Inside knee pain runs along the inner edge of your knee, right at the joint line. Press your fingers there. If it's tender, that is zone 2. This pain gets worse when you twist, pivot, or you squat deep. Sometimes it swells after walking on uneven ground or playing sports with cutting movement. 2 main structures live here, the medial meniscus and the MCL. Your meniscus is a C-shaped shock absorber made of cartilage. The MCL is a ligament that prevents your knee from bending inward like a broken hinge. When you twist or pivot, you load the inside of your knee with rotational force. If your meniscus is worn or it's torn, that force irritates it. If your MCL is stretched or strained, same problem. So how do you tell them apart? Well, your meniscus, that pain is sharp. It catches, sometimes it locks or it clicks, and you'll feel it deep at the joint. MCL pain is more of a stretch or an ache along the edge. You'll feel it when your knee wants to collapse inward. Red flag for this zone, if your knee locks completely and you can't straighten it, or if you have catching that prevents full range of motion, that may need some urgent imaging. Now, not every click needs an MRI, but true mechanical locking does. For most inside knee pain that does not lock, meniscus pain without locking responds to conservative treatment most of the time. Strengthen your hamstrings and quads to take pressure off the meniscus. Avoid deep squats and pivoting movements until it calms down. If it's MCL pain, you need to work on hip stability. MCL strains often happen when your knee collapses inward because your glutes are not firing on time. Do single leg balance exercises, lateral step downs, and glute activation work before any activity. Train your body to keep your knee aligned so that the MCL does not have to work overtime, preventing collapse. But wait until you hear about zone 3. That one doesn't quit easily. If your knee keeps flaring up and you're not sure which zone is actually irritated, I made something for that. It's called Knee Pain Relief in under 5 minutes. Simple movements that can reduce inflammation. Free at 5kneerelief.com. The link is also in the description below. Now let us talk about zone 3, the stubborn one. Outside knee pain runs along the outer edge of your knee, and sometimes it radiates up towards your hip. It is less common than front or inside pain, but when it shows up, it's persistent. It's like that song that gets stuck in your head for 3 days, except it's your knee reminding you it exists with every single step. You feel it when you run, especially downhill, or when you squat, or when your knee tries to bow outward. 2 structures typically live here, the IT band and the LCL. Your IT band is a thick strip of connective tissue running from the hip to the outside of your knee. When it gets tight or overworked, it rubs against the bone on the outside of your knee. That friction creates inflammation. It is basically your body's version of a rug burn, except it's happening inside your knee. The LCL is a ligament that prevents your knee from bowing outward. IT band pain often burns during repetitive movement and gets worse with mileage. LCL pain is usually sharp and specific. You feel it when your knee buckles outward or after an awkward landing. Red flag for this zone: if you have sudden instability after an awkward landing where your knee feel like it might give out or give out sideways, get evaluate. Do not wait on that one. For IT band pain, you need to release the tension. Foam roll your outer thighs, stretch your hip flexors and the TFL muscles at the top of your IT band, and strengthen your glutes, because weak glutes let your knees collapse inward during running, which pulls IT band tight like a guitar string. For LCL pain, you need rest until it heals. That rebuilds the hip strength to prevent the compensation that caused it. Outside knee pain takes time, but it responds to consistent work. Now, zone 4 is the one that makes people the most nervous. Back knee pain sits deep behind your knee. Sometimes you feel a tight or full sensation back there. This one makes people nervous because you cannot see what's wrong. You feel it when you straighten your leg fully or after being active all day. Two common causes: hamstring irritation or a Baker's cyst. A Baker's cyst is way more common. It's a fluid-filled sac that forms when your knee produces too much joint fluid. Your knee makes this fluid to lubricate the joint, kind of like oil in an engine. But when the joint is inflamed, it can overproduce. That excess fluid has to go somewhere, so it pools in the back of your knee and it forms this cyst. Imagine a garden hose with a kink in it. Water is flowing through at a normal pressure, then it hits the kink. Pressure builds up right behind the kink because the water can't get through. The hose starts to bulge where the pressure is the highest. Your knee does the same thing. It's making more fluid than it can process, so the fluid backs up and it pulls behind your knee. Baker's cysts are usually not dangerous. They are just annoying. They can limit how much you can bend or straighten your knee, and sometimes they ache. But here's what most people do not realize: the cyst is not the real problem. It's the symptom. The real problem is whatever is making your knee produce too much fluid in the very first place. Often it is arthritis or it's a meniscal tear. So draining that cyst is temporary. It will just come back unless you treat the underlying inflammation. Now here's the critical red flag for back knee pain. If you have back knee pain with calf swelling, redness, or shortness of breath, seek urgent care immediately. That can indicate a blood clot, and that is not something you want to wait on. I've seen people brush that off thinking it's just tight muscles. That's dangerous. For typical Baker's cyst or hamstring pain, if it's hamstring related, stretch your hamstrings and strengthen your glutes to offload those tendons. If it's a Baker's cyst, address the inflammation that is driving the fluid production. Gentle heat and movement can help. Reduce your load. Get imaging if it's not improving, and sometimes we drain it or we inject large cysts, but that's the short-term fix. Long-term, you need to figure out why your knee is actually inflamed. I do knee surgery for a living. I should want you on my operating room table. Instead, I just spent time teaching you how to avoid me, because most knee pain does not need surgery. It needs the right diagnosis, and diagnosis starts with knowing which zone is actually irritated. If you're ready to figure out exactly which structure is the problem and how to fix it, visit workwithdrkellum.com. Link is in the description. Subscribe if this clicked for you. Drop a comment and tell me which of the zone matches your pain. I'm Dr. Kellum, and remember, the wrong zip code means you wasted time, but the right diagnosis means faster relief.